Good evening and welcome to our COVID-19 update program. I'm Nelta Egbe sitting in for your regular host. And here are the highlights at this hour. Plateau State Government acquires mobile testing van, says over 366 million naira has already been spent in the fight against COVID-19. More institutions of learning reopened for academic activities across Nigeria as members of ASU in Anambra State kick against reopening of schools. And in the United States, COVID-19 related death toll surpasses 200,000 as infected rates exceed 6.8 million. Now, the part of the efforts by the Plateau State government to flatten the curve of COVID-19 have led to the round of engagements with stakeholders to discuss strategies that will curtail community spread of the pandemic in the state. Governor Simon Along, in one of the latest meetings, enumerated the government's commitment to efforts made at curtailing the spread, especially in the communities, which prompted the gathering, so that both the government and the leaders will be on the same page in fighting the scourge.
This parley in Jos, the Plateau State capital, was called to seek ways to curtail community spread of the coronavirus, and in attendance are former political office holders, state senior citizens, community and religious leaders, members of the organized private sector and civil society organizations, with representatives from the World Health Organization and the Nigeria Center for Disease Control.
We've ordered for mobile testing vans, which have capacity to diagnose over 30 health conditions, including COVID-19, HIV, Ebola, hepatitis, among others. We have received commendation from the Presidential Task Force on COVID-19 for our community testing strategy, as well as our sensitization and mobilization strategy. Plateau State is now rated the third best in the country in terms of testing, which has given us a fair picture of the pandemic in our state.
Governor Lalong also explains that over 366 million naira has been spent so far by the state government in the fight against COVID-19 and is asking for the cooperation and support from all to win the battle.
We are grateful to the kind-hearted people, including many of you, that contributed our 123.3 million naira, as well as other food and medical items valued at about 155 million naira. We similarly appreciate the World Health Organization that recently donated 100 million naira to the state government, which has greatly helped us to treat those infected by the virus. Such donations also enhance our capacity to distribute palliatives to the weak and the vulnerable to cushion the impact of the pandemic.
And in preparation for the reopening of public schools, there's commitment on the part of the state government with the training of teachers and principals, disinfection of school environment, and rearrangement of seating in line with safety protocols.
And it's now confirmed that academic activities for tertiary institutions will resume in Delta State on or before the second day of October 2020. Commissioner for Higher Education Professor Patrick Mobagare explains that the students will resume in phases for conformity with the COVID-19 safety protocol. But he assured all students and the parents of the provision of materials that will ensure the safety in accordance with the guidelines stipulated by the NCDC and the federal government.
The Asaba campus of the Delta State University has not seen any academic activity in the last 6 months. The campus is deserted, taps are running dry, and overgrown grasses have taken over the environment. Mindful of the situation at hand, the state government says provision is on top gear for all students in tertiary institutions in the state to resume.
All staff in Delta State University are back to work because they prepared for them. You know, they started in phases. Now everybody is back, preparing for the students. So they all reported readiness to resume, of course, and also accepted, they had no option, to abide by the COVID-19 protocols as given to us. And I've gone around a few of them. I'm satisfied. I am satisfied.
However, how ready are those in charge of these institutions to receive these students in the face of COVID-19 pandemic?
We are ready. Okay. Initially, we were using the social media, but later the university developed a software for engaging the students while they were away, and we've been using that to cover grounds. So as soon as they come now, we just take a few weeks to revise what we've been giving to them online, and then get them to write their second semester exams.
As tertiary education resumes physically in classes across the state, school authorities have no choice than to monitor strict compliance with all protocols to further curtail the spread of the virus.
Well, members of the Academic Staff Union of the universities at the Chukwuemeka Odumegwu University in Anambra State are kicking against the resumption of classes as directed by the management, insisting that they are still in solidarity with their national counterparts on industrial action. The union insists its numerous demands have not been met by both the state and federal government and asks parents not to allow their ward to return to school as they will not be taught.
Chukwuemeka Odumegwu University in Anambra State is deserted despite an announcement by the management of the institution that exit students should resume on September the 21st.
Solidarity forever, for the union makes us strong.
It's a decision that does not go down well with some members of the Academic Staff Union of Universities, ASU.
For instance, if you remember, few months before.
At a press conference at the university premises, the chairman of the union insists that the school infrastructure in its present state does not meet the COVID-19 standards, and ASU is yet to call off its industrial action.
The union has made several efforts in ensuring industrial harmony in Koyu, but all explanations for management understanding of the reasons for ongoing strike has failed. Koyu is not the only state university in the country or in the southeast. The Congress of ASU Koyu resolved today to sustain the union struggle. ASU members are therefore not going to be part of the university's resumption as announced by Koyu management.
ASU has been on strike since
In a swift reaction, the Vice-Chancellor explains that the notice of school resumption is only for final year students and is based on the directive of the state government. He laments the inconsistency of the union members, describing their action as an attempt to tarnish the image of the school.
Is whether you be on strike or not, this university must exist. That is what I believe. If you're on strike, no problem. Don't disturb us. We wanted to start our lectures online. They said they are on strike. We now said, no problem. Let us also wait for government. The government now says start, and they say they're on strike. And I want to ask one thing. If you're on strike, should you touch my money?
According to the Vice-Chancellor, 41 members of staff out of 600 employed by the university cannot ground the institution's activities. And the ASU strike, which is hinged on IPIS, is not the university's concern because it's not running on such a structure.
In Adamawa State, the government has commenced the distribution of sanitary materials for over 500 mothers and pregnant women in the internally displaced persons camps in the state. The distribution of these items was instigated by the state government's concerns about the possible community transmission of the coronavirus within the IDP communities as a result of unhygienic practices. Therefore, preventive measures by the state government to help stem the spread within the IDP camps by ensuring that healthy practices among the women in internally displaced camps are adhered to.
Approximately 7 months into the pandemic in Nigeria, Adamawa State is stepping up its campaign against the dangers of the COVID-19. The State Primary Healthcare Development Agency is visiting the St. Theresa's Catholic Church and Makoi IDP camps to distribute sanitary items for nursing mothers, pregnant women and children. The IDPs, mostly women and children, are out to receive their August visitors. 1 out of every 4 persons is a child at this IDP center, with about 60% of the children between the ages of 1 and 5 years old. First, the IDPs are sensitized on the importance of adhering to the guidelines of the COVID-19, especially social distancing and the use of face masks, practices which are lacking in the camps. This is followed by the distribution of the items that will help in the sanitation of the immediate environment.
And we feel that IDP camps are areas that hygiene is of utmost importance. Where you have a poor sanitary hygiene, what else can you do to support these children? So that's why we feel the diapers, pampers are very important. They help in promoting self-hygiene, personal hygiene of these children, and also to prevent them from preventable diseases that can occur from such bad personal hygiene practice.
A director in the agency appeals to the beneficiaries not to sell the items, but to use them for the purpose they're intended, even as beneficiaries express gratitude.
It is important to them. They'll use it in their children, and also we are also giving the pregnant women, they use it after they have delivered their children. So they should use it wisely, use it when they are using, they should wash their hands before using it, and also wash their hands after using the pampers.
It will really help, more especially in this issue of COVID-19 that we are in. It will really help us by using the pampers whenever our children, in the aspect of teething periods like that. I truly believe that it will really help us.
This intervention by the Adamawa state government stresses the importance of a clean environment as necessary in preventing the community spread and the transmission of the coronavirus disease amongst people living in the internally displaced camps across the state.
Now, talking about the health and the rights of the humans resident in Nigeria, the Executive Secretary of the National Human Rights Commission, NHRC, is in Imo State for the commissioning of a school building project to assist qualitative education of children in rural areas, especially in this COVID-19 era. Our correspondent Aitokwe Kutei reports more details about the Commission's efforts at ensuring that everyone's rights are safeguarded in Imo State.
As part of efforts in contributing to the fight against COVID-19 pandemic and giving qualitative education to children in the rural areas, the National Human Rights Commission, NHRS, has built a COVID-19 compliant 3-classroom block for pupils in the Central School Ezi East Onitsha community in Ezinite local government area of Imo State. According to the Executive Secretary of NHRC, Tony Ojukwu, this gesture is in response to the impact of COVID-19 pandemic on school system in the rural areas. He said a 3-classroom block is accompanied by 6 modern toilets, functional borehole, and a generating set to help them when they resume school.
What the National Human Rights Commission has done here is to set a standard for other Nigerians. Because under the COVID-19, it will be difficult for any schools to reopen without these basic amenities, like water, like good toilets, like lights, like a very well erected classroom, which will take a minimum number of students. So this is taking the COVID-19 response to another level, to the community level, so that we can encourage other Nigerians, let them also go to their own communities and do things like this, so that the children can be safe.
He said with the distribution of free hand sanitizers, face masks, liquid soap, and strict adherence to social distancing in their classes, pupils of Central School Ezi East in Onitsha community, Ezinite local government area of Imo State, are set to resume. From Owerri, the Imo State capital, Aitokwe Kutei for COVID-19 updates.
And in Jigawa State, the government says despite the continuous testing across the state, no COVID-19 positive case has been found. The Executive Secretary of the Primary Healthcare Management Agency, Dr. Kabiru Ibrahim, told Channels Television after a stakeholders meeting at the State Secretariat in Dutse that the success recorded is not unrelated to the general drop in the number of cases in the country. Our correspondent in Dutse files this report.
As the number of COVID-19 infections in the country continue to drop, activities in Jigawa State have almost returned to normal. The Jigawa Infectious Disease Center in Dutse, used as an isolation center, is now an empty building with COVID-19 response ambulances parked. The executive secretary of the Primary Healthcare Management Agency believes the efforts of the government, coupled with that of the general public, helps in the fight against the pandemic in the state.
The number of subsided cases that are usually reported by the members of the community are really very low now. And this may not be unconnected to the fact that the cases on the general note, if you look at the trajectory in the country, cases are coming down. There are not as many as we used to have in those days. So I think it's all related to the fact that there are better communication mechanisms. There are more protective efforts being put in place. Every meeting you see COVID protocol being taken into consideration with all degree of seriousness. And I think it's part of the reason why we are not having positive cases, even though we are doing some tests as it is for now.
While COVID-19 is still of concern in the state, Mr. Isa Mustafa, a member of the civil society organization working on financial management and auditing in the state, believes the shortage of manpower is a major problem in its healthcare delivery.
While the world are grappling with the corona pandemic, in Jigawa, malaria is a major problem. And these health workers, they were overwhelmed by the patient, because if you look at the ratio of our doctors, nurses, and all other professional staff, if you take the ratio by state, you may find out that a doctor has to look after over 10,000 people in Jigawa state, which I think is humanly impossible for him to do that. So I think it's high time for the state government to consider recruitment of health workers and teachers and all other cadres in the state.
As COVID-19 is gradually being curbed in the state, the hope is that the pandemic is a pointer to revamp the healthcare services, not only in the state, but the country as well.
And over in Borno State, the face of humanitarian intervention has changed as a result of the coronavirus pandemic. Local non-governmental organizations are now engaged in grassroots distribution of palliatives and sensitization of the people on the safety protocol. Reports show that people living below the poverty level are not bothered about the safety protocols, or all they care about is just a means of livelihood. Christian Aid and the European Union say they are working with local NGOs to reach out to the target population. 3 months into that project, a roundtable assessment meeting reveals that the new strategy is working, with compliance level recorded in target communities rising from 1% to 85%.
They have been vulnerable because of the insurgency in Borno State. They were IDPs and they are still IDPs. Then coupled with the pandemic, it makes their case more precarious. And coming in with this palliative of 20,000 every month, I mean, it's really big money as far as they are concerned. So that one was able to take care of their needs, and coupled with desensitization, we embarked upon in the communities.
Why we're giving them this money is because people are under lockdown. Their sources of livelihood was short. And these are people that barely eat 1 square meal a day. So this particular household that we identify them as vulnerable now is to provide them with cash that they can use to take care of their needs, not only food alone. There are many needs they can take care of. So that was the idea why we giving them that money. Is not to stop the COVID, but is to reduce hunger and poverty.
Nigeria's testing capacity is inching towards 500,000 as the country confirmed 195 cases in 24 hours. The new cases are reported from 10 states and the FCT. Enugu having 51 cases, Gombe 40, Lagos 39, Plateau 23, and the FCT 15. 12 cases are confirmed from Rivers. Kaduna has 8, Ondo 3, Bauchi 2, Edo and Ogun have 1 each. The 7,663 infections are still active in the country, one of the lowest in the past 3 months. Kogi and Zamfara states have no case on admission, while Lagos is managing 3,532 active cases, the highest in the country. And in Borno State, the government has commended parents for complying with the basic directive of providing their children with face masks and hand sanitizers at public schools across the state. The special advisor to the state governor on education, Mr. Matthew Miam, gave the commendation while inspecting school resumption and compliance at the Government Girls Secondary School, Makadi. Correspondent Parasango reports.
Well, after a 5-month forced holiday caused by COVID-19 pandemic in Benue State, students have resumed in public schools today. However, the case is different with private schools, with most of them scheduling 28 September for resumption. We were here today at the school to check compliance to COVID-19 protocol of temperature check, hand washing points, hand sanitizers, use of face mask, and as well as social distancing among staff and students. And the special advisor to the governor in education, Honorable Matthew Nyam, was here to enforce and see how the schools are coping with a new procedure.
Here I've seen that they have started already, because I went to SS3 class and discovered that most of them were having books in front of them. That shows a sign that they have come back as usual and they want everything to be carried out as usual. They know that they are back to school and they should face their books. And I really want to encourage that teachers should continue to encourage the students to forget about what they've been doing in their houses, because most of the students have forgotten about school. The parents and the teachers should put hands together to make sure the student first education, which is paramount to their life, and that is the only thing that can help them in future.
The principal of the school tells us that, of course, it is difficult for students who sometimes forget their face mask, but they've told them to put their face mask in their bags while coming to school so they won't forget the use of it while in school.
For the school activity, the academic activity, we are holding revision with what they learned in their previous classes, like J1, present J2, revision of J1 work is being done for them, then SS2, their SS1 work is done for them, so that to just as a starting point before the new class work is done.
From the Government Girls College here in Makodi, Pius Angbu for COVID-19 update.
And now to help us look at the recent resumption of schools protocol and adherence to this protocol, we're being joined by a consultant public health physician, Dr. Alera Roberts. Thank you for joining us, Dr. Roberts.
Thank you for having me, Nyota.
Okay, so we see that the students are back in school, higher institutions, secondary school, primary school, albeit some private schools are yet to resume. But so far, from what you see in terms of adherence to the protocol, are you concerned?
No, no, I'm not concerned in terms of the fact that largely we're finding that a lot of the schools are ensuring that the teachers and pupils do adhere to the public health guidelines that have been put in place in terms of social distancing and hand washing. However, there are still a lot of concerns for the quality of water and sanitation hygiene that is available in the schools, because in a lot of the schools where this water and sanitation hygiene things were not available, it's very difficult for them to suddenly, make them available all of a sudden. But I know a lot of governments are trying very hard to make sure that that happens, but it needs to be ramped up very, very quickly.
Yeah, I do. Yeah, our correspondent in Borno talked about a commendation from the state government to the parents of providing some of these things for the students. But we all know that students have a tendency to forget face masks and even possibly the sanitizers. So when you talk about quality of water and sanitation equipment provided, then one begins to wonder if the parents don't enforce or ensure the children carry these things, does that mean that part will be missing in the process or in the places where the school is unable to provide all of it in all the corners of the school?
Well, this is the concern, isn't it? I mean, this is the biggest fear. I mean, a lot of these places, I'm looking at the schools that we have even available in Lagos State and the schools that we've seen in many of the other states where it is clear that the water supply is at best marginal, the sanitation, hygiene, the hand washing facilities are poor, toilet facilities are poor. And then, of course, then you start worrying about children wearing masks and whatnot. Children will be children. I mean, they are going to run around and see each other and be very excited to see one another. But it's important that we make it clear. I mean, the fear is not actually for the children, because we know that the children, even if they do get infected, do not manifest the more severe forms of the disease. The concern is for the loved ones at home, older members of the family, the teachers and other workers in the schools. And therefore it behoves upon them to make sure that the children are conforming to the guidelines. But more importantly, the children cannot be made to wash hands if hand washing facilities are not available. So it's a two-way thing. I mean, parents need to create the demand, and the governments need to respond to the demand that parents and teachers are creating. Because we've seen the effect of the pandemic, particularly on the teaching profession and on the teaching population. You know, schools being closed meant that school fees were not being paid, meant that teachers were not earning a living, and they are a critical, crucial part of national development.
Okay, talking about fees and the cost of education here. So there's been that concern that within this period, the cost of food has gone up, the cost of electricity has gone up, the pump price of fuel has gone up. So there's more demand for the resources coming into the salary earners and even for the businessmen. So now schools are reopening, school fees will be paid. Do you think the government should be looking at some sort of palliatives, maybe increasing salaries or some kind of intervention to ease the burden on the parents and the students, just so that the teachers get paid and the students can still get an education without too much of pressure on the parents?
Most definitely. Most definitely. I say it over and over again, almost every time I'm here, that the twin engines of national development are education and health. I mean, any responsible government can see the advantages of education and worse still, the disadvantages of ignorance, where we don't even have a framework of reference to be teaching people anything about disease causation. So yes, the government must urgently address the issue of palliatives and supports and financial aid to the educational sector. Definitely. Don't forget, the universities have been on strike ever before the pandemic was declared on account of this, because there's no point saying you're sending a child to school and the school doesn't have even the facilities to teach properly, nor the personnel to carry out to give a good education, as it were, and carry out a full curriculum. We're trying to train people for a global economy. How do we do this if we're sending our children out half-baked or unbaked at all?
But in what form should those interventions be?
Thankfully, that's above my pay grade. The people who they can figure it out. They can figure it out. Certainly, schools need to be properly equipped, need to be properly structured. The equipment, the teaching facilities need to be there. Laboratories need to be equipped. Desks and chairs. I mean, I was looking at the Benue school. I mean, for goodness sake, is that the best we can do for our children in terms of tables and chairs? Libraries need to be there. Access to digital education needs to be there. Online learning resources. The barest minimum now that any child should have to learn is a basic tablet. You know, internet facilities so that the children can get online and learn. We have seen a widening of the digital divide between the children in the so-called public schools and the children in the so-called private schools. That cannot be allowed to continue.
Well, let's look at the situation of the children now. Let's maybe just step back a bit and look at what parents could be doing, because I do know that there are a lot of parents that are watching us now, and those who have relatives that have children now are watching the program as well. So what could they be doing to make things easier for the children as they go to school, besides educating them and continuously reminding them about the pandemic and what they can do while they're in school and on their way back and all? What should they be doing?
Well, parents need to be creating a demand very loudly for more support in order for their children to be able to go to school. A lot of parents are sitting at home watching this with hearts beating wildly with fear at the thought of having to pay school fees and where is the money going to come from. At the same time, want their children back in school so that they can go and face the workaday world that they have to go and face. A lot of parents haven't been able to work effectively because they are at home looking after the children. And when we're talking about single parent families, that's even worse. So definitely parents need to be creating a lot of loud demand, as well as teaching their children the basic elements of sanitation, hand washing, and social distancing. Not that social distancing will work among children, let's be honest.
Okay. Now, there's this school of thought that's concerned about how much of adherence there is out there in public as to the safety protocol, especially with the opening up of schools and the worship centers. There are those who feel that, I mean, if the worship centers and the schools can open up, then this thing is done with. So we should all get back to our normal life. But I'm not sure you're one of those that agree.
Well, to be honest with you, Neil, I'm becoming a bit ambivalent about it because let's face it, I am a scientist and I do follow the evidence. So the evidence is we have not seen the degree of morbidity or mortality, the degree of illness or death that we've seen elsewhere. And it's very hard to convince people to do the basic things if they're not seeing illness, people falling in the streets, they're not seeing deaths. You know, we're only hearing about the rich and famous who are dying. So it's very, very difficult. But I think that we cannot waste a good crisis. And this is a fantastic time to really insert the messages of sanitation, hygiene, water supply. And these are things that the government has to take on, has to tackle head on. So I don't know. It's a bit difficult to convince people when all they can see are the less salubrious parts of this emergency response. We need to see more strengthening of the primary healthcare system. That hasn't been seen. We need to see more strengthening of the healthcare personnel, the frontline workers, the doctors, the nurses, the medical lab scientists, the technicians. We need to see strengthening of all those cadres of healthcare professionals who are so vital in making sure that we remain disease-free. It's not just the COVID pandemic. Don't forget, we are still battling Lassa fever. We still have every other form of illness. We've got increase in the cases of cancer coming up, diabetes, hypertension. So every healthcare system to be properly strengthened.
When you talk about this matter of how do you convince people when they're really not seeing the more morbid cases that we keep hearing about in other parts of the world? The concern here is that, are we even testing enough in Nigeria? I mean, at one time, the Presidential Task Force on COVID-19, in one of their briefs, talked about the fact that people were not even willing to go to the test centers to even get tested. Should mass testing be done? I mean, bring the testing machines to the streets and practically test everybody to find out if we have people carrying this disease and walking around unknown to them.
Well, yes, it's a good idea I wish we could do mass testing, but the question I would still ask is that if you do test someone and they do test positive, what are you going to do with them? Are you going to now isolate them for 14 days? Are you going to insist that they self-isolate when you cannot support a daily patient? So, I mean, testing is all very well when you have the means and the infrastructure to be able to deal with it, but I think it's a bit disingenuous to insist on people being tested when you really don't have a solution for them either. So that's another thing. What I would love to see, though, would be rapid antigen testing, which is much faster, much cheaper, and can be done over and over again. It does have its downsides, but most and generally the upsides work. But in a country such as ours, without a supportive healthcare system, testing is, I don't know.
Neither here nor there?
Neither here nor there.
Okay, but then you see the trend in Europe, in some parts of Europe, where there are more concerns. I mean, it's like a second wave, and some are even talking about a third wave of the pandemic. Do you see, or I'm sure you're praying that such a wave will not hit Nigeria?
I don't know that it will, because we didn't even see much of a first wave. If you ask me, if we did see a first wave, then we were largely asymptomatic. But they are seeing a huge upsurge in cases, and then they are also getting into their flu season. So as an American, healthcare professional said, they're getting into the fluvid twindemic period, which we never even got into at all. Flu has never really, the influenza period has never been much of a concern to us in hot West Africa for reasons we still don't know, but we're very grateful for. So I don't know that we should worry too much. What we are seeing, and that is very important, what we are seeing are the effects of this pandemic on our economy. And that's actually even more devastating than the effects of the pandemic on the people themselves in terms of disease and death.
Thank you very much, Dr. Alera Roberts, a consultant public health physician. Thank you for sharing this evening with us.
Thank you for having me, Neilta.
And let's go on to the United Kingdom, where the Prime Minister, Boris Johnson, has asked people to work from home once again as part of a raft of new coronavirus restriction measures, just weeks after repeatedly telling workers to return to the office. Mr. Johnson told the House of Commons that the country was at a perilous turning point, like fellow European nations, France and Spain. COVID-19 cases in the region have spiked in recent days. Our correspondent in London, Juliana Olayinka, has more.
After days of intense speculation, a second national lockdown in Britain was confirmed by Prime Minister Boris Johnson in an address to ministers at the House of Commons earlier today.
For the time being, this virus is a fact of our lives, and I must tell the House and the country that our fight against it will continue. We will not listen to those who say let the virus rip, nor to those who urge a permanent lockdown. We are taking decisive and appropriate steps to balance saving lives with protecting jobs and livelihoods.
The country is on the brink of a second serious outbreak, just weeks after barely recovering from the first. Yesterday, there were 4,300 confirmed positive COVID cases. According to the advisers, if we continue along this trajectory, there could be 50,000 cases a day by the middle of October. To put this into context, in June and July, cases were below 1,000. According to Chris Whitty, the government's chief medical officer, speed and action are desperately needed to prevent the spread.
So we have, in a bad sense, literally turned a corner, although only relatively recently. And I think everybody will realise that at this point the seasons are against us. We're now going into the seasons, late autumn and winter, which benefit respiratory viruses, and it is very likely they will benefit COVID as they do, for example, flu. So we should see this as a 6-month problem that we have to deal with collectively. It's not indefinite. And as I come on to, science will in due course ride to our rescue. But in this period of the next 6 months, I think we have to realise that we have to take this collectively very seriously.
For ordinary Brits, this second, albeit less restricted lockdown, will have serious ramifications. How does one choose between financial survival and self-isolation, when clearly it's impossible to have it both ways? The United Kingdom already has the biggest official COVID-19 death toll in Europe and is borrowing record amounts to pump emergency money into an economy facing its deepest recession. Juliana Olayinka, reporting for Channels Television News in London.
And now we're being joined by Juliana to give us an update what the situation is like on ground. Juliana, now, for days, the Prime Minister has been calling people to return to the office indeed, and then he now tells them, you know what? Just work from home. But when you go out on the streets of London, what kind of vibes do you get from them?
Well, I've got to tell you, at the moment, it's pretty tense here in Britain. It kind of feels like it felt just weeks before the 23rd of March when we went into our first lockdown. Just a couple of hours ago, Prime Minister Boris Johnson delivered an address to the nation that was shown across all main media stations here in the UK, and he really emphasised that Britain is at a critical juncture. The next couple of months are likely to be the most difficult months anybody has ever faced. I think Prime Minister Boris Johnson was honest enough to say that he, in his generation, has never been through anything like this. But as outlined in my report, cases are climbing expeditiously here in Britain. Today they were 37 deaths, much less than our peak of 1,000 deaths, but this is the highest death rate we've seen in the past couple of months, and there is no vaccine in sight thus far. And so the only way to kind of put a circuit break, as the scientists are calling it here in Britain at the moment, is to go into some sort of restrictive lockdown. A COBRA meeting took place earlier today, and devolved administrations in Northern Ireland, Scotland and Wales were present. But there does seem to be a different approach. Nicola Sturgeon, the First Minister of Scotland, and Arlene Foster, the First Minister for Northern Ireland,
have gone much further in the restrictions. People cannot mix with other households, and it is a lot tougher. But Boris Johnson has really got a delicate balancing act. We're in a deep recession in this country, and of course there are fears about going into a second lockdown because, of course, the economy is on the brink of collapse.
Indeed. And at the end of the day, worried about the economy, one of the questions you asked in your report was the choice that people had to deal with, the citizens thinking about survival against an economy that is down there, really, really pressed down. And then the fact that you have the health concerns, is like being stuck between the devil and the deep blue sea. So what choices would the people have to make going forward?
It's a difficult one. And again, going back to the Prime Minister's address, he said, that we've got to be honest with ourselves and acknowledge that in a freedom-loving country, some of us have broken the rules. And I think he was pretty clear that there are going to be stricter fines for up to £10,000. Any pubs, bars and restaurants that are open past 10 could lose their business licenses. But, Prime Minister Boris Johnson is a populist leader. He won on that populist slogan vote. And there was a snap poll done earlier this evening by YouGov. And it did say that 77% of the public are backing the Prime Minister. Again, I think he was pretty stark and grim in his address to the nation today, making everybody in Britain know that it's down to you as an individual to curb your behaviour to stop the spread of coronavirus before we have a vaccine here.
So in whichever case you find yourself, you better choose life above any other thing, right?
Absolutely choose life behind every other thing. But again, it's really important you picked up on your first question about the working from home. Just 3 weeks ago, Prime Minister Boris Johnson was urging people to get back into the office. There was a slogan as well going around on Twitter about #SavePret, which is a local coffee chain here in Britain. Of course, there are several others. But now that's reversed. They're asking people not to return home. Businesses have spent thousands of pounds trying to make their residents COVID secure. There are dozens of small businesses, the bookkeeper, the post office, the coffee shop, the dry cleaners that rely on people coming back into the office. TfL, the rail franchises up and down this country, seeing passenger numbers fall. So this is a huge conjuncture, as I was saying, for Britain. And it is a delicate balancing act. And I suppose, those that can't afford it potentially won't be staying at home. Because
All right. Thank you very much, Juliana. Thank you. Our correspondent in London, Juliana Olainka. You do stay safe as we go on with the task of reporting the situation out there. Thank you so much. And in the United States, the death toll has surpassed the 200,000 death mark from the pandemic. The number of cases in the country has also gone beyond 6.8 million, higher than any other country in the world. Now, here's the global update.
Marseille's naval firefighters have been testing school toys and furniture for traces of coronavirus to make sure cleaning has been done properly after cases of the virus were detected. It's a procedure the Operation Comet project says is the first of its kind in France and one that they have been carrying out up to 18 times a day. Once a school reports a case of COVID-19, cleaners go in, followed by the firefighters, will take swabs rubbed onto school materials and surfaces, which they run in a machine that gives results in about 45 minutes. Health officials in Israel fear that the 3-week lockdown imposed on Friday, September the 18th, may not be long or restrictive enough to slow the daily case toll and relieve hospitals. New cases have reached daily highs of more than 5,000 among Israel's 9 million population, and the doctors are warning that health facilities could soon reach capacity. The country is sharply rebounding from single-digit lows following a relatively stricter initial lockdown from March to May. South Korea has suspended its free influenza vaccination programs aimed at reducing the burden on its healthcare system strained by persistent outbreaks after reports that storage problems occurred during distribution of the flu shots. The country, which is facing a resurgence of COVID-19 cases since August, planned to procure 20% more flu vaccines for this winter season than the previous year to immunize 30 million people and start free inoculation on Tuesday for some 19 million eligible people. Finally, in China's Santa workshop, sellers are fretting over saving Christmas. Vendors and manufacturers in Yiwu are at pains to try and save Christmas this year as the novel coronavirus pandemic upends international business travel, forcing countries, including China, to place stringent curbs on entry into the country by foreigners. With no improvement on the situation, sellers in Yiwu who are used to doing face-to-face bulk deals with their customers have to rely on video conferencing, and that has hampered business further.
And that's our package in the COVID-19 update program for tonight. You can take a closer look at some of the COVID-19 global numbers in real time. Visit our website, channelstv.com. There you will get more update and better understanding of all you need to do to stay safe during this period. And of course, there are other stories on politics, business, and sport. Do join us for fresh packages of the program sometime tomorrow. Thank you very much for watching. I'm Neota Egbe, and have a good evening.